Good evening, everyone. This is United Medical ACO Diabetes Program, Wednesday Wellness Webinar. My name is Kemal Erkan. I'm the Chairman of United Medical ACO. And I have three speakers with me, Amy Wilcoxon, Caroline Weber, and Donna Gunkel. How are you guys doing?
Very
Thanks.
good.
How are you?
Good. So I would like to introduce our other members as well, so you may see them time to time in these events. Our program director is Dr. Ibrahim from First Aid Bengal, and then Tim Nakul from Spine and Orthopedics Physical Therapy. He is also part of the program, as well as our social workers. And one of them is Roxana Portla. She did, I believe, present last time. And we will be with you guys second Wednesday of each month, and a support group on the fourth Wednesday of each month. So our panelists will be Caroline Wilson-Weber and Amy Wilcoxon, and then Don and I are on the admin side, and then we'll have some dialogue around the diabetes prevention. So I would like to have our panelists introduce themselves, and then we can start after that.
My name is Amy Wilcoxon. I'm a dietitian and diabetes educator with United Medical ACO.
And my name is Caroline Weber. I'm also a dietitian with United Medical ACO as well.
And tonight, as Kemal said, we're going to be talking about diabetes prevention. So a lot of our webinars over the past 2 years have been about topics specific to people with diabetes, but today we're talking about how to prevent getting diabetes in the first place. So there are a lot of people, and I should really have that statistic ready. Kemal, I'm sure you could pull it up or might already know how many people are living with prediabetes, and there's a large percentage that don't know that they're living with prediabetes. And you can live with prediabetes for quite a while without developing diabetes, and it's reversible. So even if you have prediabetes, a lot of these tips we're going to talk about tonight, you can use.
All right. Donna, if you would like to also introduce yourself, because each session we have different people maybe watching.
Sure. All right. My name is Donna Gunkel, and I am the Clinical Director of Integration here at United Medical ACO. So I oversee the diabetes program and our dietitians, as well as our behavioral health program, care coordination, and our care manager teams.
All right. So.
All right. So we're going to get started. So we're going to talk about many different ways for the diabetes prevention, as Amy discussed. So first one is exercise. So we talk a lot about exercise and physical activity with all of our patients that we see, but especially for either treating diabetes or working with pre-diabetic patients as well. So we all know exercise is good for us. We know movement is good. We get our muscles moving. But how does exercise reduce the risk and improve insulin health? Exercise acts like insulin in the body pretty much. It directly reduces blood glucose levels. So when you exercise, you're teaching your body how to store the sugar in your muscle rather than just letting it sit in the bloodstream. So the more exercise you do, the more your body effectively uses that sugar. So it takes up that extra glucose. Its immediate benefit for exercise is lowering those high blood sugar levels. So exercise triggers that uptake from the bloodstream to work in our muscles and our organs. So there's some really good studies out there that show that taking a short walk after a meal, like a 15-minute walk after a meal, is good for lowering blood glucose, as well as a 45-minute walk in the morning. There's different studies showing which is more beneficial, but overall, any kind of physical activity is beneficial for helping to maintain that blood glucose. There's a really also great study which shows that increased physical activity can help reverse prediabetes, which affects more than 1 in 3 individuals in the United States. So super important. We know exercise is great. We know it benefits our blood glucose. So another aspect of that is building muscle. So the more we exercise, the more we use our muscles, the stronger they get. So that muscle mass is important because it helps the glucose. You can dispose the extra glucose in response to the insulin. So it's been shown that for people with prediabetes, an increase in overall muscle mass can reduce that risk of developing diabetes by almost 32%. So that's pretty outstanding. So across like a full range, higher muscle mass has been shown relative to the body size is associated with better insulin sensitivity and lower risk of prediabetes. Of course, we need some kind of further research to kind of see the appropriate exercise interventions that are designed to increase that muscle mass for the incidence of diabetes. But some really great studies out there that show that muscle mass and exercise really do help lower those glucose levels. But this also makes a good point. So we talk a lot about weight maintenance with prediabetes as well. So if you start to exercise and do a program and you're not losing weight, should you give up hope, right? Because, you know, you're not seeing results, so you think it's not working. But because that fat, the fat cells, they're being converted to muscle. So if you lose that fat and you're gaining muscle, you can even if your weight stays the same, you're still changing the balance and the shift of that. So you're still benefiting even if you're not seeing immediate results in any kind of weight loss. So speaking of weight loss, you know, that exercise, getting that continuing consistency is improving weight maintenance overall. So losing just, you know, 5 to 10% of your body weight can improve your A1C. And although nutrition is the main driver of that weight loss, in addition to exercise, allows for those greater outcomes. So yeah, that is how we can reduce risk and improve that insulin health. The next point for preventing those complications. So we know with diabetes comes those complications and those risks, right? So if you're going over to that direction, you're in that diabetes realm, the physical activity can help many more places than just those blood glucose levels, like improving our vascular health, getting the oxygen to the nutrients to where they need to go, lowering inflammation as well, or improving cholesterol, blood pressure, helping to restore some nerve function as well. So it helps many more areas, even far beyond preventing diabetes. It helps those going through it to prevent any kind of risk factors associated with diabetes as well. And then kind of some exercise recommendations. So we know it's important. We know it prevents further complications. Then how much are we supposed to do? The ADA recommends at least 150 minutes per week of moderate intensity aerobic activity, like a brisk walk, some cycling, ideally weekly, spread over at least 3 days with no more than 2 days going in between. Consistency is really the key. And they also associate this number with, you know, improved blood glucose levels as well as reduced risk for cardiovascular disease. So for those engaging, you know, the high intensity exercise, anything really physically exerting, shorter durations of 75 minutes have proven to be sufficient as well. But also, we also think that when we think of exercise, you might think of, oh, I have to run, I have to bike, and go straight to that aerobic idea of exercise. But strength training is just as important because we discussed the muscle mass portion of how it affects our blood glucose. So strength training, incorporating that slowly into our workout routines can help improve our A1C even more than just sticking with walking, biking, that aerobic activity. So we know how much we're supposed to do. How do you get there? A lot of the time we find it difficult to, you know, incorporate into our busy schedules. The first step is getting the go-ahead from your healthcare team, making sure you're in contact with your physicians. There's a lot of pre-existing conditions, coexisting conditions that you might want to talk to your doctor about before stepping into a new workout routine, especially if it's rigorous. And making a plan that if you do have diabetes, that you're making a plan to ensure your blood sugar stays in a really good, healthy range. Because physical activity can lower blood glucose for up to 24 hours. So you want to make sure that if you do have diabetes, you're checking blood sugars regularly, knowing how those activities affect you. Keeping a snack on hand just in case if your blood sugar dips low, but also making sure that you know that exercise, if super intense, can cause blood sugar to raise. So keeping in contact with your doctor, monitoring your blood glucose, seeing what activities affect you. But really the first step is also to take those baby steps into exercise. So it's been shown to kind of slowly increase your way to build your endurance. We might not have exercised for a while, so getting back into it can seem pretty stressful, can seem hard on your body as well. So if 150 minutes seems like a lofty goal, setting a goal for 45 minutes of exercise and then increasing that slowly throughout the week and throughout the months as you kind of build that endurance. It can be one of the best ways to stay motivated is to keep building on those goals. We talk a lot in our counseling about building tiny goals and building upon those because they're more likely to be successful rather than having this giant goal, trying to achieve it, not doing great, and then you get discouraged. So slowly building upon those goals are great. So another thing, I know this is great for the to-do list people because I'm one of them, scheduling those workouts or physical activities. So specifically writing out a time, I'm doing it after I wake up, I'm going for a walk after dinner. And that is great because it keeps you accountable, right? We talk a lot in our appointments with our patients about, staying accountable with yourself, giving yourself grace when you need to, but staying physically active. The best time to really is probably around 1 to 3 hours after eating, because that's when your blood sugar is usually the highest. But it's shown that any physical activity is better than none. So if you can't fit that walk in or that cycle in after you eat or something like that, it's okay to fit it in when you can. And for us busy people who don't have the time for 45 minutes straight of an activity, split it up. You can absolutely take 5 to 10 minutes out of the day, do a quick walk around the neighborhood. All that adds up, and all you're using your muscles, you're using the sugar in your blood. So I think any kind of physical activity has been shown. And this graph is one of my favorite visuals. I love it because it's directly showing the decreased risk of diabetes with the exercise frequency. So the exercise frequency, if you're exercising more times than not, it's been shown to have a decreased risk. So we can see that those non-exercising individuals have a much greater risk. So even just by going for a walk regularly, once a week, we could lower our risk for diabetes, which is fantastic. One of the final things I think is important, I talk about it a lot during appointments, is finding something you enjoy. So you could tell anybody, go run 2 miles a day, and if I hate running, I'm not going to do well. So finding something you enjoy, doing it with someone you want to have a conversation with while you're walking, something to get you motivated. And then it's, as you find something you enjoy, then kind of work into your schedule, maybe adding some strength training sessions, some weights on non-consecutive days. So taking that into mind and keeping up with a regular activity for daily living. So doing the laundry, taking the trash out, being physical, not just at that activity time, but getting up and walking the extra mile when you get out of the car, park a little farther away. Any of those little steps, they really do make a difference.
And I want to add in with Caroline those are really good points about keeping up during the day. And I get it. I coach, I'm working full time. I have kids at home. It's hard. If you think, well, I don't have time, I have to go to work, I have to take my kid to this activity. But so I like to look for like active wait time. So this morning, my son had tutoring. So, and she said, a lot of people go to the store, it's right there. So I didn't need to go to the store. So I went for a walk because otherwise I could have sat for 40 minutes. Or, if your kids have soccer or swim team, I used to see the swim team moms walking, and if you went around the pool 4 times, it was a mile. And taking advantage of that. Caroline talked about those short walks during the day. There is research there's several cultures where people will do a leisurely walk for digestion after they eat. And they've studied these walks with the effect on blood glucose, and they do directly lower that postprandial, that post-meal glucose. So if you think, well, I don't have time, or 45 minutes, 30 minutes can really seem like a long time to get out there and walking if you're not used to walking or you just hate walking. Yeah. But if you think, well, I only have to walk for 8 minutes, it doesn't seem so bad. I can do anything for 8 or 9 minutes. And we just saw Kemal's dog. If you have a dog, they like to walk.
Yeah, good motivators.
Kemal, you're on mute. We missed your dog.
I was saying that you can get a puppy and then you do some exercise.
Getting in multiple walks through the day with a puppy. And then I also wanted to touch in on the strength training too. There actually was a study a couple of years ago, because cardio is always the push, walk, 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 walk. And they studied people who lifted weights 3 times a week, and they did 3 sets, think it was 8 to 10 reps for 8 weeks, significantly lowered their A1C. So for people who think, well, I don't like all that cardio, I'm willing to, you can lift weights. It's just, as Caroline said, it's just as effective. And the last thing I would add to is the mental health aspect. So all this change is so hard, but when you're moving, you feel better. I did a study in grad school on treating eating disorders, binge eating in particular, with exercise. And there's so much research on anxiety and depression with exercise. The 20 minutes of exercise is like a low-level antidepressant. So certainly not to take place of therapy or medication. But if you feel better, then you may be willing to keep going and to keep doing other things. So, and take, good care, prevent diabetes. So it's another point. I know I can be an exercise.
So I think one of the, maybe we mentioned this in one of our sessions, but for some of our patients who may be in this group, they may be in maybe their 60s, 70s, and exercise means the perception of the exercise is not necessarily going to the gym. That's what we are trying to emphasize, right? So taking a walk, like doing your shopping, food shopping and other stuff, and then just go through the extra aisle, the 3 or 4 of them, that will get you like 700 to 1,000 steps for one time. So, and if you can actually move more frequently, so that just sitting for 4 hours is not going to be ideal, right? So you do want to, even if you are able to go upstairs and downstairs and just move a little bit, that's the exercise actually we are really kind of talking about, nothing heavy. And, I think there was a study that walking is probably the most effective for all ages. And based on the duration of the walk, then you can adjust that. But you can, I see my mom doing this now, that she used to not go for shopping. But since we talked last time with Dr. Osmani, so we told her that she should go with whoever is doing her shopping, she should go with them. And then she can walk around. She do that. And I think those things do help. But one of the, going to the gym these days, especially 65 and over, is always problematic. If they have the maybe financial means, maybe someone coming to the house at least for maybe twice a week for weight training, and then they don't need to be lifting so heavy stuff, but they may need to have some discipline to do it. So maybe some instructions from a professional person may be helpful. And those are all available, but the easiest one and the cheapest one is to walk and do gardening. So then
and I think too, the point was 65, there's silver sneakers, which if you have Medicare, you have not all plans, but most plans can access silver sneakers. And so since COVID, if you don't know what silver sneakers is, it's free or reduced cost gym for Medicare. So if you put in your zip code, it tells you what gyms take silver sneakers. But since COVID, now they have virtual classes. So you can go, if you can see your computer, your TV, and to move around, you can do these classes. One of the things I also push for people who are older, my mom and my mother-in-law took me a couple of years, but I finally got her in the pool, and then COVID happened. I have to get her back in the pool. Is water aerobics, because it's gentle. You don't have the pressure, you don't have the impact, and it's very social. So there's a lot of talking, and if you don't show up, the people want to know where you've been. So you have that, you're expected that accountability to be there, and you do everything at your own pace. If it hurts your feet to touch the ground, they have belts, you can be in the deep end. And if you can't swim, you wear flotation belts anyway to keep you afloat. So you don't have to be able to swim, but there's no pressure on the joints. The Boys and Girls Club has reduced price frame in Ellesmere, and the Boys and Girls Club in Bear. There's certainly the Y. LA Fitness, which is no longer, it's Esporta, has a pool with a very crowded water aerobics class. So there's a lot of options out there in the water.
I was going to say there's also the senior center, because like my mother-in-law, right, because she moved in with us. So in Newark, the senior center there has an indoor pool.
Yes, I forgot. And you only have to be 50, right? I think you only have to be 50 to join the Newark Senior Center.
Yeah. And it's fairly inexpensive. I want to say it's like $25 or $28 a month to use the pool. And I know they have some classes, but she enjoys just getting in there and walking. So again, you can get your walking because they have, you know, the shallow part. And so she'll just get in there and walk. And again, it's easier on your joints, but you're still getting the resistance, right, with the water and the exercise.
It's great. And there's Modern Maturity in Dover has the pool too with the same thing. I think you only have to be 50 or 55.
Yeah, I'm pretty sure it is either 50 or 55 up here too. I can't remember. Yeah. I think I qualify for it, but
you don't have to reveal our ages.
None of the rest of you do, but I did want to circle back, Amy. You had asked a question, so I was trying to search for some information about pre-diabetes. So I was able to pull up the burden of diabetes in Delaware, a study that was done a few years ago. And one of the things that they indicated is approximately 91,358 people in Delaware, or 11.7% of the adult population, have diagnosed diabetes. An additional 24,000 people have diabetes but don't know it, and therefore they're greatly increasing their health risk. And then 268,000 people, or 35.4% of the adult population, have prediabetes. So again, their glucose level is elevated. So I just thought, since you had asked that question, and we look at that, that is a large number of
So if you count 11, 24, and 35 all together, that's...
Yes.
Wow.
Oh, wait, the 24,000 people in Delaware have diabetes but don't know it. So they didn't give a percentage for that one. Okay. But
so I was thinking, my goodness,
I would say it's a small percentage. But still, you're looking at about at least 50%, right? Because the 35 and the 11, almost 12. So, you know, right there is people that are actually diagnosed. So a large number, but I just thought I'd add that in there.
Yeah, I did have, going back to that exercise for, you know, the pool being great for low impact. I've been recommending a lot for some of my patients who are maybe immobile or have chronic pain. We talk a lot about chair exercises because I do them at home while I'm sitting at home and working. If it's a time in between appointments, I'm moving around. So there's a lot of good YouTube videos of chair exercises, things you don't have to use your feet for. Especially there's like a Zumba one. So there's tons and tons of resources out there. Even just doing a YouTube search of like chair exercises for beginners, chair exercises for seniors. They're really helpful. And personally speaking, they're very helpful. That's another option out there.
One of the sessions we did yoga, right?
We did in December. She did chair yoga. Yeah, Melissa Stanley.
Love yoga. Love it. It's really nice. Because some days you don't feel like getting out there and moving. Like sometimes I don't want to walk 2 miles. Sometimes I'd rather just like lay on the ground and do some yoga or sit in a chair. And it's you can do the same every day. All right.
So, we should probably move to the next. Move beyond exercise.
Big topics today. Fiber. I think I can speak for Amy when I say this is one of our favorites.
Yes, it's all we talk about.
All we talk about, whether you have prediabetes, any other conditions, we'll always talk about fiber at one point or another. So fiber, just to give a brief overview, is a nutritious and healthy diet can provide a range of health benefits. It's great, especially important for preventing, you know, and managing diabetes. Fiber is a type of carbohydrate found in many fruits and vegetables, whole grains, legumes. It helps keep you regular, which is important in health, but it also offers many, many other benefits, especially with people who are going through prediabetes or have family risk of diabetes. So dietary fiber is what we can call roughage or bulk, refers to those components in the plants that our body can't break down or absorb. So unlike other meal components like lipids, proteins, other types of carbs without fiber, the body doesn't digest that. So instead, it goes through the stomach, through the small intestines, through the colon, largely undamaged before it exits the body. Mostly found in those fruits, vegetables, whole grains, beans, legumes, and it's recognized usually in its ability to prevent constipation. But on the other hand, they can help maintain a healthy blood sugar, which is what we'll focus on today. So specific benefits and impact on blood glucose. Research has consistently shown that people with type 2 diabetes or at risk for diabetes, eating more fiber can help improve that blood glucose control because the body's unable to absorb or break down. It doesn't cause this spike in blood sugar as carbohydrates that don't have fiber may do. This can help your blood sugar kind of stay in that target range. So it can also do great things like protecting your heart, maintaining that digestive health, which we also go into a lot when talking about fiber. But I think one of the greatest things is it can help you stay full. So it helps us with our weight management as well. So since it can't be digested, it moves slowly through the stomach, making you feel fuller for longer. And many foods high in fiber can tend to be lower calorie options, depending on what you go for. But according to the CDC, high fiber food takes longer to chew. So it gives our body more time to recognize if we're full or not, rather than rushing through eating. So it can reduce our overeating, help with that weight maintenance part. Digestion takes longer, so blood sugars rise a little more slowly. Fiber keeps us fuller for longer, allowing water to kind of remain in our stomach and intestines, keeping that full feeling going. So one of my favorite studies for fiber, there was a large study done about insulin resistance and dietary fiber consumption, consistently showing that associations of high dietary fiber intake, which we'll talk about that range in a minute, shows a 20 to 30% reduction rate in the developing of type 2 diabetes. So does wonderful things, including keeping our blood sugars in a great place. So when we're talking about fiber, there's two different types. Soluble fiber and insoluble fiber both play an important part in our body.
Not question maybe, but more like just verifying my understanding. So the fiber cannot be digested, right? So we are saying it's going into our body, or like going through our body without being broken into the sugar cells, I guess. So then,
right. So yeah.
Well, one second. Let me see if I can get him out. The crate is open, but he doesn't know how to get out.
I think if you want to
keep going. Okay.
If there's anything else that you want to add right now,
sure.
Just give a moment or two.
I could go on
talk
for hours.
more about okay.
Amy, did you have any comments on the first part of that?
No, I think I was thinking about what Kemal was saying, so I got sidetracked about like, no, it doesn't convert into sugar. But actually, and what you were saying too is that you see a reduce in the uptake too, because of the slowing of the rise of glucose, we also see a reduce in the uptake of insulin. So you have a much slower rise and therefore slower fall and you don't get that big dump of insulin with it too. It's interesting, those studies that show the increase or the decrease with diabetes with fiber, and the studies came out around the same time with the people who eat more fiber way less, and then all of a sudden there was this explosion. Splenda with fiber, ice cream with fiber, Fruit Loops with fiber. So I was like, well, that doesn't count. That's not real.
Right, adding it in. Oh gosh. So there are two different types of fiber. So soluble and insoluble. So soluble dissolves in the water, forming this gel-like substance in the stomach that slows down that digestion, and it helps control the blood sugar. And like as you see advertised, helps the cholesterol lower, which can help prevent and manage diabetes complications. So it's great to have that in the diet. And the soluble fiber can be found in foods like apples, bananas, oats, peas, black beans, lima beans, Brussels sprouts, I think avocados too. Mm-hmm. And then insoluble fiber is the type that doesn't dissolve in water. So it's typically remaining whole as it passes through your stomach. And it supports that insulin sensitivity and helps keep your bowels regular So that insulin or that insoluble fiber is found in that whole wheat flour, like your bran muffins, like the nuts, the seeds, the skins of many fruits and vegetables. All right, so we've talked about the impact of fiber on blood glucose control, the 2 different types of fiber, how much should be consumed. So the dietary guidelines of 2020 to 2025 from Dietary Guidelines for Americans recommends 22 to 34 grams. Sounds like a lot because actually, fun fact, no one gets most people don't get that much. Usually, I think, what is it, half of half?
I think it's 8 to 10 grams a day is the average intake for the average American.
So chronically low in fiber. So the specific amount between that range really depends on your gender, age, those types of things. So women, usually we recommend 20 plus, like maybe 25 if we can get there. Men, you could go a little higher. But how much does that look like? I love this example because I don't think anyone would do this, but 6 apples, right? If we eat 6 apples a day, that's what 30 grams of fiber looks like. Obviously, you could if you wanted to, but we wouldn't recommend eating 6 apples a day. But there's plenty more other types of fiber you can incorporate to reach that goal. I know adding a bunch of different fruits and vegetables, for fun the other day, I tracked it. I was like, I wonder how much fiber I'm eating. So I tracked it and I reached my 25 grams. I was so proud. But I know most days you probably don't because it's hard to, fit those things in. So how do we incorporate more fiber? Some steps we could easily take to kind of transition into increasing our fiber intake is having a fiber-friendly breakfast. So finding a whole grain piece of toast, adding chickpeas, like mashing them up on some avocado toast or a bowl of good oatmeal, homemade oatmeal with those steel cut oats. Throw in some nuts, maybe a few berries. That would be a great way to start your morning. Choosing those whole grains, though, that's where you're going to get it in. So looking for a bread, if you're going to eat a bread, make sure you have that whole grain flour as a first ingredient, swapping out white rice for brown rice, or maybe trying quinoa, or maybe a wheat pasta. There are a lot of good brands. Sometimes the texture, you'll have to get used to it. But I know we always kind of start with our whole grains, make dietitian recommendation just to make half your grains whole grains. So that's an easy way to kind of remember how many grains, whole grains am I supposed to get a day. Another way is focusing on your non-starchy vegetables. So excluding corn, peas, and potatoes, looking for those green vegetables, maybe some cauliflower, incorporating them into your meals. I just spoke with someone today about they don't like vegetables. So they make like a sofrito out of it. They blend it up real small and still get a serving of vegetables in it by topping some meals with it. Yeah, I was like, that is brilliant.
I have to try that with some of the people in my house.
Yes. I was like, in case you don't like vegetables, that's one way to kind of add them in there. And then we know beans and legumes, they're great sources of fiber, pinto, kidney, garbanzo. So I know in my waiting room, I have a recipe for black bean brownies. And they're great. They're packed with protein and fiber. I think I've brought them into the office a couple times and people liked them. So they were a staple. They were great. So seeing how you can add those different things into daily routine, when you're grabbing a snack, incorporating a fruit, vegetable, nut, seed, that is a good source. But the main key I tell everybody is take it slow because we don't want any digestive upset. Your body has to get used to it. So if you're at 8 grams a day, go to 10 maybe the next day, gradually work your way up because I guarantee if you overdo it, you will not want to eat fiber again. So going slow, that way you can kind of get your body used to it.
One of the things too I will recommend is if people who don't like oatmeal, they like cream of wheat better, is Oat Bran, because Oat Bran is higher in fiber, higher in protein, but it has that creamy sort of texture like cream of wheat. It doesn't have that bigger, thicker texture, but it is high because cream of wheat, unfortunately, doesn't really have a lot of fiber. But Oat Bran does. It has 7 grams of fiber, 7 grams of protein. It's very filling. And not somebody asked me the other day, that box, not the crackling Oat Bran hard cereal. So Oat Bran, like oatmeal, but Oat Bran is another good way. And you can do a lot of stuff with it too. It's pretty tasty.
The benefit of the fiber also is not just limited with diabetes, right? So with the heart disease, colitis disease, constipation. So the benefit of fiber is not limited with well-balanced glucose level, but also with the other diseases. So it's going to be helping. So I think many people don't know, maybe in some cases, how easily they can actually access to those foods, or they don't actually have the right balance in their plate. So hopefully this will just kind of remind them.
Well, I think a lot of our patients also will say they don't eat them because they have irritable bowel. So that's something, it's a really good reason to see a dietitian, because we can help you with that. We can't help you with the irritable bowel, but we can help you with what to eat to not react, because there are certain types of fruits and vegetables that are going to make your symptoms worse. But certainly if you have irritable bowel, you absolutely can eat fiber. It's just, you have to control the amount of insoluble that you have and the timing of it, but it's doable. So it's not a reason to say I can't eat vegetables, because you absolutely can.
Agreed.
All right, so.
All right, so hydration and water, huge things. This is one of the first things I ask patients when I see them is, how much water are you drinking? Because 60% of our body is composed of water, 75% in muscles, 80%, I believe, in our brains. It's what we use for most body processes. So our body relies on good water intake. And water does far more than we realize. I think it aids in our digestion, lubricates joints, it flushes waste products. And a lot of the time, I think we're busy bees all the time going around. Maybe don't think of, in the summer it's a little different because you're hot, you get thirsty more quickly. But I just think sometimes we need to refocus and then talk about all the benefits of hydration and how much we should get. So there was actually a great study in 2011. It was a French study that found that lower water intake in adults without diabetes were associated with later development of hyperglycemia. It didn't connect directly to type 2 diabetes, but it showed higher blood glucose levels. And then in another study in 2021, it determined the intake of water was correlated with reduced risk of type 2 in women and men. So given what we know that the positive effects of water overall, it shouldn't be too surprising that those heavier water drinkers experience better outcomes than the lower water drinkers, especially if the other beverages consumed were high calorie beverages or sodas, things that maybe coffee or dehydration could occur with those types of beverages. So whether or not dehydration causes high blood sugar, we know that high blood sugar can cause dehydration. So keeping that in mind. But what exactly does water do to impact our blood glucose? So the kidneys, they use water to flush out excess blood sugars. But when that water is not being replenished, the flushing can cause the blood to be more concentrated. So it kind of thickens a little bit. And that means the sugar in your blood will be more concentrated. And the kidneys, they'll keep flushing, but staying hydrated can break that cycle, kind of restoring that good balance and helping the kidneys maintain those good blood sugar levels. So key roles for sufficient water intake in patients with prediabetes, diabetes, or just in general for better health. It dilutes our blood glucose. So I use this all the time. Think of a glass of water, right? You mix a small amount of sugar, stir it, let it dissolve. Then you place that glass outside on a sunny day, right? With the evaporation of water, the remaining water present, like that glass is going to become much, much sweeter than it was earlier. So it simply dilutes our blood, allowing less glucose to kind of stick around. It reduces the insulin resistance. Drinking up to 8 to 10 glasses a day brings down the blood sugar levels of a person just by reducing the body's insulin resistance by providing that proper hydration. And then allowing, it also allows us to reach that satiety in less time during mealtime. So if your goal is weight loss, right, and you're having trouble with some overeating, portion sizing, drinking water with that meal is going to help you get fuller faster. Obviously, water doesn't replace a meal, right? We still want you to eat, but it'll help prevent that overeating or maybe overindulging in portion size on a more regular basis. So how much water should we drink? There's tons that you could search for days and find tons of recommendations out there. Some people say a gallon, some people say you drink your body weight, right? 8 cups usually is what you'll hear more commonly. The National Academies kind of recommend that women consume 11 cups per day as men consume 16, but that's in total of drinking and your food intake, because your food intake is also contributing some water into your system. So that 8 cups is really kind of just, it's not black and white, right? So you have this kind of recommendation that involves both food and the beverages you're drinking. So there's no definitive rule on how much you should drink, but there are some good guidelines we can follow to make sure we're properly hydrated. The most important recommendation, you should always drink when you feel thirsty. Usually at the point of thirst, you're past dehydration. So making sure that you don't need to force yourself to drink to reach a specific goal, but trying to drink continuously through the day rather than, gulping it. I didn't drink today, let me gulp it all down. That's probably not as beneficial as, sipping throughout the day, hydrating yourself consistently. Shooting for, I tell patients mostly a minimum of 48 to 64 ounces for, minimal hydration. Even if you don't feel thirsty, take those few sips. So better to proactively drink a little bit. We also know that thirst can be off in patients going through diabetes as well. So keeping that in mind, that is not always a great indicator of your hydration status. But, if we say the average person without diabetes should drink 8 glasses, a person with diabetes should definitely take that to heart as well. So maybe we need to drink a little bit more. So I'd say about, that 8 glasses of water per day, adds up to 2 liters. It's about 67 ounces. Sounds like a lot, right? So I know I struggle in the morning to get my 32-ounce cup down, but, having those little things that encourage you to drink, like I get a nice pretty cup or a nice straw or some kind of, I know there's water bottles with markings, drink this by noon, drink this by 2 p.m. And that is a reminder or an encourager. And I have patients who even set reminders on their phone or they have tracking apps. They sometimes track their water intake. Yes, right. And so it does help kind of a little bit, to have those little encouragers out there to help you. But always a good preference to add is it is possible to drink too much water. So consult your physician. Obviously, if you have kidney, thyroid, liver, heart conditions, make sure that if you're staying within a fluid restriction, if you your doctor recommends that. But yeah, staying hydrated helps those blood glucose levels and many, many, many more things.
And I think too, knowing what you like. So when I switch to these metal water bottles, I don't like really cold water. So when I go through and they're thicker, so there's not as much water in here as my other water bottles. So sometimes I have multiple water bottles on my desk if I have time between patients to go fill them. But I like to fill them up at home because if I fill them up at work, it's very cold, the water. So it's hot and cold. So and if you're somebody who drinks more with the straw, if you like really cold water, you want to get the metal water bottles because it will keep it cold. So knowing what's going to help you drink. I used to always have a very big water bottle because then I only had to drink 2 of them. But then I had a hard time cleaning the bottom of it. So I had to switch. One of the tips too, I used to recommend people, if you have a refillable, so if I know I want to drink 3 of these, to put 3 rubber bands on it. And then so I feel those every time I pick it up. So once I drink one, I take off a rubber band, and the same thing to get through to the other ones. Because like Caroline was saying, and once you get used, it's so important. Once you get used to drinking, your body's
going to want it.
I do tell people like the fiber to increase gradually because your bladder in the beginning is a little not so happy.
Yeah, you'll be running to the bathroom a lot.
Don't save it all for night. Start early because otherwise you're really going to be mad at us because you're going to be up in the bathroom.
And I think, go ahead, Donna.
No.
I was going to say, I think keeping it in front of you is key, right? At home on the weekends, I tend to drink less water because I get up and I'm busy running around. When I'm at work in the office, that's the first thing I do in the morning is I have my metal, container, which is, I think, 22 ounces of water right there. So to your point, you find that you sit there and drink. And when it's empty, you go fill it up and then you go to the bathroom and then you start the process.
Walk around a little bit. Yeah.
Right. You tend to drink more when it's right in front of you. The one thing I do have to do like on the weekends is if I'm going to go somewhere, I make sure I take a water bottle with me. I am more likely to drink it when I'm out running errands, and going places than I am if I'm here busy doing things. I have to remember to stop and drink the water. So again, finding something that works for you.
My family gives me a hard time because I will sometimes use my water bottle at home because I can track it. If it's glasses, I don't know how much I've had. And I don't know how much more do I need. I don't know.
I also have a lot of patients who don't like the taste of water, right? So they need something more flavorful. So we also talk a lot about, what are good things to add to our water that, aren't full of sugar. I know that liquid IV I talk about all the time, it has a lot of sugar in it. So yeah, it hydrates you, but it'll make your blood sugar go up. So there are other options like that. Yep. So he's got some fruit in there, kind of infuse it into that, some good citrus flavors. Someone today just told me they got a soda stream. I love my soda stream. You can add different flavors to it in a seltzer water, lower sugar. You're still hydrating, right? And I consistently use like low sugar, no sugar, water flavoring like Mio, keep it on my desk so that I'm inclined to, okay, I need a flavor boost. And you can control, the one thing I like about these is you can control the amount of flavor that goes in. Some people like the Crystal Light packets, but there's tons of options to kind of flavor your water, increase hydration. I'm a big fan of the seltzers. I like them a lot.
One of the things that I have like 2 of these bottles, let's say. So one of them is always prepared from the night before. So I have cucumber, lemon, and ginger in it in the middle. So then I do refill that throughout the day. So, but then the other one is always there overnight. So then the first one is usually better. Like first one is a better one. But this does help because it's not just like, you don't want to get, as you said, you don't want to get extra calories, but you do want to have some taste. And this is the easiest way, these calories that you won't take any extra calorie by doing that. And if you get really hungry, you can actually just open it up and then eat the cucumber in the middle.
Quick snack.
It's a salad. I think you love today. So when we talk about like how much water that we take, like today was a really hot day. So obviously, days like today is going to be the water intake needed to be more than our average recommended numbers, as well as when it's cold weather, that may actually reduce how much hydration that we are going to need. But especially summer days like this, we do need to even drink more than what's average recommended. So we just want to make sure that we remind our patients that. Now, one thing is, I don't know if you, sometime in these events, so I'm also the technical guy, so then I'm doing stuff while you guys are talking, I may be missing. Did we talk about like, I don't know if everyone looks at their urine after they pee, but the color of the pee is like the big indicator for the hydration. And many people, I'm assuming that people do know that, but that would be sometimes a good indicator to maybe pay attention to those for patients who may be at risk for diabetes.
And it is something we talk about, that it should be pale to, pale yellow to clear. You should be going regularly. It's something when I work with teenagers who don't like to go to the bathroom at school, I said, well, maybe you should get used to going to the bathroom at school, because going 8 hours without going to the bathroom is not a good sign.
Not good for you.
Yes, it's not good for you. So if it's particularly strong odor, so sometimes something with diabetes, people will see, especially with early stages of kidney disease, that it has a strong odor, or it's very, very dark. It's not a good sign. So that tells you I better start drinking. And like Caroline said, it really has that direct impact on glucose. So when people say, well, what do I do if I wake up and my sugar is 250? The first thing I say is drink a lot of water, because it will die. It's not a miracle. You can't go to the Cheesecake Factory and drink water and think you're going to be okay, but it's going to help. So do that and go for a walk, like the earlier slide, because those immediate things are going to make a difference. Because it's so important.
So, well, I guess we have one more slide. Like how often?
One or two. How often do you? So these are some other things to stay on top. A little bit less exciting than fiber and exercise and water. So one of the things, and I think this ties in with what Donna said about that huge number of people who don't know they have diabetes. So there's people I will talk to, and they'll say, "Well, I had my because people send, I'm sure to all of you, people send their blood work and you think, well, what do you want me to do with it? And I'm not talking about patients, just family, things like that. My blood sugar is 100, which is, it should be under 100, normal blood sugar. For people without diabetes, should I be concerned? And I will say, well, have you had an A1C done? Well, what is that? So we talk about it. So the recommendation now, if your BMI is over 30 and you are over the age of 35, you should have an A1C. It used to be very hard to get an A1C before the age of 40 and even after 40. A lot of primary care doctors will not order it unless blood sugar comes back over 100. Now, to their credit, insurance won't always pay for it. So it is important to see your doctor regularly, because you will not, a lot of people will say, I didn't know my blood sugar was high, because you won't have any symptoms until it gets really high. So if you're walking around with blood sugar 150, 180, 200, it's pretty gradual and you're not going to have any symptoms. So you have to go to the doctor to get your blood work done, and then and you can stay on top of it. So especially the next slide, we're going to talk about family history. It's really important to do that. And if your doctor is not monitoring your A1C and your blood sugar's been fine, you can still ask for them to do. I asked for a long time. They never did it until I turned 40. And then finally she agreed to do it. And now she'll do it for me every year. But it's certainly your right to ask for it. And if insurance isn't going to pay for it, you can always find out how much it costs to be done. But again, over 40, they will usually do it. So, because remember, A1C is that 3-month average. So your fasting blood sugar, which is going to be in your general blood work on your basic metabolic panel, that's blood sugar for just that one day in that moment. So even if it is 100, maybe you didn't do your full fast. Maybe you had a crazy night out the night before, and maybe your A1C is totally normal, or maybe that 100 is indicative of something that you're trending up. So it's good to know what's happening so you can be proactive and make changes. And then I do have one more slide.
And I just want to add real quick while you're talking about with the doctors. Many of the doctors we have from various specialties, right? From endo to cardio. One of the things that they always say is it is important to get those visits in with your specialist and with your PCP, because you may feel fine because your body gets used to the abnormal. I remember Dr. Hundle saying that you can be walking around with a very high blood sugar, a high 1A1C, but it's because you've had it for so long. That doesn't mean you are fine. Your body has adjusted to it, but at some point you're going to feel and you're going to have a lot of effects from that, right? And then it's going to be too late.
You're right.
So
and they study that. People who go by feel for blood sugar, because we do have a lot of patients who will say, well, I'm just going to check my blood sugar. Oh, I know when it's high, so I only check when it's high or when it's low, because I know how I feel. And they said they studied the by feel people, and their A1C, I think the average was like 10.5. So
again, we probably mentioned this time to time, but what's so interesting is how underdiagnosed, right? So the A1C is, because in our bariatric program, so one of the things that we do ask for TSH, A1C, and hemoglobin. Patients come with 9, 10, 11, 12. And the last 12 months, I have at least 6, 7 patients that I remember with 15, and they didn't know that they had diabetes.
15.
15.2, 15.1, 15.5. So, because these are like big numbers. So I'm like, how do you not actually go to the doctor when you have 15, A1C 15? So, but then 15 is a really, it's a big outlier, but we see a lot of people from 7.5 to 9.5. So many of them, they don't actually get any treatment neither from their PCP or any of the specialists. And that's actually concerning. One of the reasons we are actually focusing on diabetes is because when it's well controlled, it's not a big risk for any of us. But if it's not controlled, then it can just kill you. And that's that's really not needed. I guess that's where you're going to talk about the risk factors.
I am going to talk about the risk factors, and I'll try and be a little bit brief since I'm be mindful of time for everybody. So we talked about all the things that you can do to prevent, but there are some risk factors that you might not be able to control. So you may do, and if you do all of those things that Caroline talked about, it may be that you may still end up with diabetes if you have a very strong family history, but you can keep it in good control. Like Kemal just said, that you can stay very healthy. I still remember a gentleman I met years ago who had been diagnosed with type 1 diabetes at age 6, and he was 94 when I saw him, and still cross-country skiing and ballroom dancing. And I thought, what are you doing? I want to take notes on you. So being aware of your family history, is there diabetes in your family? And if there's a lot of diabetes, then that goes back to definitely following up with the doctor and keeping in those good, healthy habits now. So the next one is health habits in terms of, are you active, as Caroline talked about? Are you exercising regularly? Are you drinking your water? What's your diet look like? Are you eating a lot of fast food, or are you cooking a lot at home? Are you eating those fruits and vegetables? So controlling that, limiting your eating out. There was a study years ago that people who ate out more than twice a week had a higher risk of heart disease and diabetes. So I know a lot of people eat out every day. So paying attention to, so if I am going to eat out, what am I going to eat? Am I getting in my fiber? Am I getting in my water? So weight gain, 30% of people with diabetes are actually of normal weight. So weight gain is not, and there are people obviously who've gained weight who don't have diabetes, but there is an increased risk of diabetes with weight gain. So losing 5 to 7% of weight is enough to lower blood sugar. So it does not mean that you have to be of normal BMI at all. But if you have gained excess weight, as many people have over the last couple of years, taking off, like I said, 5% is enough to lower that risk. So sort of paying attention to what's a normal weight for you, what's a weight that you can maintain comfortably, and then staying in that range. So having that conversation with your doctor or your dietitian. So again, you might be somebody who doesn't really fall in the norm, but what's something you can be healthy and maintain. Race, so there are certain cultural groups that have higher rates of diabetes than others. African Americans, Latino Americans, Asian Pacific Islanders, all have higher rates of diabetes. So knowing if you're in that cultural group, if you also have that family history, then again, following up with your doctor. Gestational diabetes, we see a lot of patients with history of gestational who don't realize, they think, oh, I was fine. So if you were fine doesn't mean that you're guaranteed to stay fine. So 50% of patients who had gestational diabetes, which is diabetes in pregnancy, end up with type 2 later in life. So it could be 20, 30 years later. So again, it goes back to that slide before, seeing the doctor, staying on top of it. If I had gestational, I would be asking for an A1C every year to know where I am. I mean, you have a 50% chance of not getting it. So absolutely staying on top of it. Other health habits like smoking, obviously. So smoking is something that as dietitians, we don't talk a lot about, but smoking does decrease your insulin sensitivity. So people always think, oh, heart, all of that, but it absolutely can increase your risk of diabetes, and does a lot of other bad things too, obviously. So there's a lot. Caroline talked about all the proactive things. So I think my point with those is sort of knowing where you are. What's your family history? What's your current health now? What are your labs? When's the last time you went to the doctor? A lot of people skipped. I think we saw that last year, right? A lot of people skipped their doctor appointments during COVID. So now are you back on track with everybody and getting your regular blood work done, which isn't always fun, but I always say, it's like doing the laundry, go to the dentist, gotta do it.
When we do the case conferences, these are daily with the ACO. Again, something that we probably mentioned, but for me to kind of see the direct correlation, one-to-one correlation between diabetes and depression, when it's not uncontrolled, this is not an isolated disease, so it's going everywhere. So then anxiety, depression, and cardiovascular disease, the sleep apnea, and other stuff, they're all together. So I call them like evil sisters, so like, or siblings maybe. So let's not be sexist, so let's call them evil siblings. So they're really, it's really simple again when you take your medication on time and you are proactively going to your doctor. I have really hard time to understand why some people don't want to go to the nutritionist. So you guys are providing an excellent service, and it's essential for. I mean, in some cases, it's even more important than the doctor's office because you need that ongoing support and kind of like plan. So you need someone to kind of keep you honest with what you started. So we have so many different options available for our patients. So we're hoping that we can reach out to more people and people to understand that this is a serious disease that needs to be taken seriously, and proactively we need to approach it so that we can keep it under control, hopefully.
And I think the one thing, Kemal, that you mentioned is seeing the dietitian. Ever since COVID, right, we've been doing the telemedicine. So it's so much easier for patients. They can do it in the privacy of their own home. If they want to share some of the food, I know the dietitians say it's easy. The patient can walk right to their cabinet and share, something with the dietitian, help me with the label, what's good, what's bad. Also, if they're at work, sometimes they can just take their break, go out in their car, do their visit, and go back in. So again, making it very easy for patients to be able to see the dietitians. We have a variety of different times available as well. So, starting as early as 8 o'clock, and then we have certain days where our appointments go as late as they end at 5:30. So we try to make it, easy for patients to be able to see us.
Yep. Anything else that you guys would like to add?
I think that's everything.
All right. Well, thank you so much for being with us. We'll be back 2 weeks from now with the diabetes support group, and hopefully we can help many patients. And we'll see you in 2 weeks. Thank you so much.
Thank you.
Good night.
Good night.